South Africa, situated at the southern tip of Africa, is a country of vast beauty and stark contrast. It is considered to be an upper middle income country by virtue of its gross domestic product per capita. However, this status is marred by extreme inequality in income and access to opportunity of its people.
South Africa is an unequal society. In some instances, we have informal settlements where people do not have proper housing. But just on the other side of the road, people live in big, huge houses with good infrastructure. Those who do not have access to services tend to be the ones who are exposed more to ill health. The biggest problem that South Africa faces is that we've got a quadruple burden of disease.
That means there are 4 major disease patterns that are killing the country. The first one is HIV/AIDS. It shows that we are 0.7% of the world population, but we are carrying 17% of the HIV/AIDS of the world. TB, we are carrying 5%, 7 times the global average. The second one, maternal, newborn and child health. We now have more mothers dying in pregnancy, more children dying before they reach 1 year, more children dying before they reach 5 years. We are now having them in South Africa more than ever before. That one is non-communicable diseases. People are now suffering diabetes, high blood pressure, heart diseases, chronic respiratory diseases. The last one is injury and violence. I don't lecture you about that.
Social determinants of health are about conditions under which people live that have implications for health. Those are access to proper roads, access to clean piped water, access to appropriate sanitation.
Poverty and inequality remain major challenges for South Africa. Unemployment stands at an average of 25.4%. It is estimated that 20% of South African households have inadequate to severely inadequate access to food. At the same time, however, a high incidence of obesity exists. The National Youth Risk Behavior Survey shows that 41.5% of youth show a high level of inactivity and 23% show signs of obesity. There are just over 14 million learners, of which approximately 12 million are in public-funded or government schools. The number of orphaned children in South Africa is estimated to be 1.5 million. These children have severe challenges when it comes to accessing the basic necessities in life, including health. Despite an increase in the number of mobile clinics and formal clinics since 1994, access to healthcare services, especially for the poor, is severely constrained by expensive, inadequate or non-existent transport.
So our transport routes must be improved, our roads must be fixed so that those who are ill, those who rely on public transport system can access facilities on time and their lives can be saved.
As you even can see behind me, it is virtually impossible. If somebody down there needs emergency care, an ambulance will not be able to get there. You have a major impact in terms of compromising the healthcare that needs to be provided.
The Community Household Survey in 2007 indicated that an average 88.7% of South Africans have access to piped water. Within informal settlements, access to water is poor. Over the last 3 years, there has been a positive trend in the way drinking water quality is being managed. However, Challenges remain present in South African wastewater management, which needs improvement.
O busy, o batla o tlhatswa, o tshwantse o tsamaye distance o yo ga metsi, and ha o fitla ka kwa o thola gona le line ka mo ready le di stove, prima stove ka nne ya cha anytime in ntlo, and I go right eto. Then ho ya mo toileting ele ba clean maybe twice a week, and then matsatsi a otlhe a itletse toilet, then I right for our health. Re bolela ka bophelo ba ka, re bolela ka bophelo ba bana, re na le bana.
Access to clean water is guaranteed in terms of the Constitution. We know that in settings such as these, people have communal access to water. They don't have individual water in their own houses, and it's probably one of the key problems that has to be addressed by government. The most common problem is diarrheal diseases. So the question is, how can we make water accessible, but ensure that there's proper sanitation and that education to the public about how they can prevent infectious diseases. This is probably one of the things that will bring health closer to environmental affairs, education, and other sectors to ensure that we can improve lives and improve general well-being of the populations, which is key for the social determinants of health.
The South African health system consists of a private for-profit health sector and a public health sector. The majority of South Africans, an estimate of 41.8 million people, rely on the public health care sector, with only 16% having access to medical insurance. The GDP split on health spending is 5% for the private sector and 3.5% for the public sector. This scenario, exacerbated by the global financial crisis, has resulted in an overserviced private sector and an underserviced public sector.
We've actually mapped socio-economic indicators that we know impact on social determinants of health. And based on those indicators, we know which of the sectors need to respond. And we think every sector must have a health goal. Our key theme is that health should actually serve as a safety net where other sectors have failed.
We have enough resources in this country to still improve on the overall quality of life of people.
For us to respond as a country effectively and appropriately, we suggest that our universal coverage must be premised on financial risk protection. And it is for that reason we are suggesting a national health insurance.
Everyone will enjoy financial protection from high healthcare costs and be able to access good health services when they really need them.
The Conference on Social Determinants of Health is key to what South Africa intends doing in the next few years, mainly because we are at the beginning of coming up with a social protection scheme in a form of national health insurance with an aim of dealing with inequities and improving the health outcomes. And we look forward to the lessons that most of the countries that will be participating in this conference will share with us.
A business-as-usual approach to fighting poverty and inequity will result in South Africa failing to reach its goals or improve the status quo. Recommendations include greater engagement between the country's leaders and its citizens, that the ethics, actions and choices of the leaders, civil society, labor and business are those that bring the country closer to an inclusive and just society